Exposure Control Plan, Video 4. At the end of this video, you will have the QR code to be able to scan to take the Check Your Knowledge quiz. An exposure control plan is a document that's put together at the workplace to answer any questions about your risks for bloodborne pathogens and to help ensure that a plan is in place if you ever have an exposure. What do we need to make sure we have in the plan? One of the main things is going to be determining people's risk. What risk are they at to be exposed to formaldehyde or blood? The exact work tasks that cause that risk. It needs to be documented that people are trained about these risks. There needs to be documentation of whether or not you've had the hepatitis B vaccine, or you have not had the hepatitis B vaccine, or you did not respond to the hepatitis B vaccine. There needs to be a particular site that's designated that deals with workers' compensation where you want to go if you have any injury. When it comes to the risk categories, the most elevated risk of exposure is category 1. And this is roles where you are definitely going to be involved with blood and bodily fluids. So this would be embalming and most of body preparation. The secondary category, or category 2, is possible or moderate exposure. So this might be where you're handling the deceased either with cosmetics or moving or placing in the casket, but you're not necessarily doing the preparation that involves the blood and the other OPIM. And then the third category is no anticipated exposure. So these positions in the office would not have any risk of contact. So this might be the office manager, the bookkeeper, or somebody who works with the families. So if you have a sharps exposure, something gets underneath your skin and causes it to bleed, the first thing you're going to do is wash your hands with antimicrobial soap and water. The other way we can get a source into our bodies is through a splash. So if something, for some reason, you're not wearing your PPE and you get splashed in the eye or the nose, you want to irrigate it, rinse it. And if there's something like an eye wash station or a shower available, you would use that emergency eye wash station, which you should be trained in if you have one. You also definitely want to report. Report the incident to your manager or whoever's in charge of exposures, and then document exactly what happened, when during the day, when during the task, and what equipment you were using that contributed to whatever happened. Then you want to immediately seek a medical evaluation from a healthcare professional. You're going to say, I'm done working for the day. You're going to take the exposure control plan with all the paperwork in it, and you're going to go to the designated emergency site. And then you're going to have a conversation with a healthcare professional about what risks you truly have and what you should do about those risks. So, one thing I recommend people have in their exposure control plan is information about the PEP line. So, that's the post exposure prophylaxis. Is this a helpline that can answer questions about what care to seek, what medications are recommended, what are the side effects of those medications? Sometimes we're not thinking straight when we've had an accident at work and we need somebody to help support us. And this is specifically designed to help support people who've maybe been exposed to a bloodborne pathogen or other infectious disease. We also look at ergonomic injury in the mortuary services area. Now, ergonomics really means that there's a mismatch between what you're trying to do physically and what you're capable of doing in the space. Having bad ergonomics leads to musculoskeletal disorders, and ergonomics in general is actually the practice of using engineering controls and administrative controls to reduce your risk. Put those words in your head, engineering controls and administrative controls, because we're going to talk about those. So, body risks, twisting, hyperextending, lateral side bending. It's very easy to reach all the way over to a tray to grab an instrument without actually walking to the tray. We really like to stretch and lean, and that's how we can cause some of these injuries. And then other body risks are slips, trips, and standing. If there's slippery or wet floors, like where we've mopped, or an uneven floor surface where it maybe goes from the tiling to the hallway, and then lifting in confined spaces is one of the bodily risks that I saw the most information for. And this involves moving the deceased, whether it's into or out of the vehicle, whether it's moving the casket, whether it is moving them onto the preparation table or onto a gurney into the refrigeration space, it is really important to make sure you're using the right amount of people and the correct techniques. And then cluttered and obstructed work areas and passageways are really common in most work areas. We like to let boxes and things pile up, but that can actually put us at risk for tripping. Having a routine cleaning schedule, making sure everything's getting clean, dusted, mopped. If there's any spills, that they're managed. Making sure that the waste is disposed of correctly every single day. Going through the exact storage precautions, where are the chemicals stored, where's the general housekeeping stuff stored, and keeping that organized is a very big part of being safe. How you handle your laundry and linens, pest control and odor control are definitely involved in this. And then documentation. So we've come to the end of the first 4 videos. It's time to take your Check Your Knowledge quiz. Scan this QR code and be able to access the quiz. I will also put the link in the description. You can go back and review all of the videos, and then after you complete that quiz, you can move on to the next set of videos. Thanks so much. Bye.